Hi, my name is James Antonov and I'm a student in the nursing program at Washington State University. Today I will be presenting on a community health resource for my Nursing 465 class. The resource which I will be presenting on will be the correctional healthcare system. In one way or another, healthcare has been part of the correctional system ever since it was founded here in the United States. But prior to the 1970s, the healthcare in prison and jails was often regarded as some of the worst healthcare system in the United States. This was attributed to a few different factors. One of these was that many institutions lacked healthcare facilities. The first national survey to look into the availability of healthcare facilities in correctional institutes only occurred in 1970. Then it was determined that only about half of the responding jails had any kind of medical facility at all. After some more information was gathered, some startling statistics were discovered. In two-thirds of the jails, the only medical facility available within the jails itself was first aid. In addition, 16.7% reported that not even first aid was available. No physician was available on a regular scheduled basis in 28% of the jails, and physicians were not available even on an on-call basis in 11.4% of the jails. Only 37.8% of the jails indicated that a dentist was available, and less than 1% said that a dentist met daily visits. Another factor in the poor healthcare was the inadequate implementation by healthcare workers. One study done in 1972 by the American Medical Association noted that less than 7% of jails examined all their inmates as part of their policy and procedure. In most cases, physical examinations were given only when the inmates complained. Also, there is oftentimes a shortage of healthcare providers for the correctional system for a variety of reasons, the main usually being inadequate funding. But there was also not much desire from the healthcare community to come work in corrections. The conditions were often very poor, supplies and equipment were frequently insufficient, and at the time there was often a stigma around correctional healthcare workers as being uncaring or incompetent. Also, many places refused to hire women at the time for the jobs inside the prisons and jails. A third leading factor into the extremely poor state of the correctional healthcare was the living conditions that the inmates had to endure. Adequate lighting, heating, and ventilation often were unavailable. Also, sanitary conditions were frequently lacking. There were reports of cockroaches, rat droppings around the kitchen and living room areas. There were also medical reports documenting mice bites and infestations of lice and vermin. Additionally, the food provided in the facilities was often inadequate and lacked nutritional content. As you can imagine, these various living conditions did not foster an environment of healing. Another very important factor that impacted the poor level of healthcare given to inmates was the legal system in the United States prior to the changes that began in the 70s. An interesting quote I found that seemed to summarize the mindset of the early correction system was by Professor Marvin Zalman, stating that prisoners were considered to be slaves of the state and entitled only to the rights granted them by the basic humanity and whims of their jailers. There was a few different reasons for this quote. One being that except for the Eighth Amendment, which general prohibition against cruel and unusual punishment, there is nothing in the U.S. Constitution applied directly to the protection of inmates. Also, the courts at the time figured that they lacked the necessary expertise and knowledge regarding the correction system to determine if actions of the prison and jail officials were justifiable or not, and figured that interfering might undermine prison discipline. The inevitable result of this so-called hands-off policy by the courts was to grant prison and jail administrators a lot of broad, flexible powers in the way that they cared for and treated their inmates. They also used this hands-off policy as an excuse to abstain from reviewing the actions of prison and jail officials. Thus, administration in the correction facilities had a lot of freedom and little regulation, accountability, and judicial or legal oversight on their daily operations, which had an impact on inmates' health. All of this, as well as a rising number of prisoner petitions for relief from negative healthcare conditions, forced courts to change their policies and develop a standard judicial review for the healthcare that went on in the correctional setting. While there are numerous different lawsuits regarding healthcare and treatment of inmates which undoubtedly help push for change, one stands out as being the turning point in correctional healthcare. This was the Estelle versus Gamble case surrounding improper medical treatment of one of the inmates. The ruling by the Supreme Court stated that healthcare for inmates was a constitutional right under the Eighth Amendment, which included the right to access of care, the right to care that is ordered, and the right to a professional medical judgment. Also around this time, national standards for correctional health care began to take hold. These standards of care have continuously been changed and edited as time goes on and the world of correctional health care changes. Before nursing, I always considered possibly getting a career in either corrections or law enforcement, and I've never been inside any type of corrections facility, so I was always curious to see how exactly that all works. And this clinical rotation, I got the chance to be placed in a minimal security corrections facility, which was quite an interesting experience. It definitely opened my eyes and made me want to learn more about the whole correction system and the healthcare that's involved now that I am a registered nurse. Washington DOC offers a wide variety of healthcare services, including mental health, dental, optical care, hearing, and hospice. One large issue in the Department of Corrections healthcare is deciding what services to cover and what not to. Thus, services are divided into three categories: Level 1 being medically necessary care, Level 2 being medically necessary care under certain conditions, and Level 3 being non-medically necessary care. Within each level, there is a long list of specific services that fall under that category. Level 1 services are routinely authorized without much of a hiccup. With Level 2 services, the practitioner will need to address the case in more detail and oftentimes request authorizations from either the Care Review Committee or the medical director, in which it is resolved to either a Level 1 or a Level 3. Level 3 services are not covered by the Department of Corrections Offender Health Plan. Even though a service may be medically appropriate, if it is not medically necessary, the Offender Health Plan will not cover it. As briefly mentioned earlier, the Care Review Committee is a group of physicians, nurse practitioner, and physician assistants who review cases that are not clearly medically necessary or unmedically necessary. After reviewing and discussing, the case is brought to a vote to see what treatment the Department of Corrections will provide. Also, if the facility is unable to provide certain services, the offender may be transferred to another facility, either in the Department of Corrections or an outside source, to receive the necessary medical attention. Funding for the DOC varies state to state. Potential sources for funding include the federal government, private sources, payment from prisoners, but the vast majority, if not all, of operating funds for the DOC come from state and local legislature. The state and city collect this money from three primary sources of revenue: sales with taxes, business and utility tax, and property tax. There wasn't one set mission or vision statement for correctional healthcare overall, but the American Correctional Association summed it up by saying, "The objectives of a health and medical services program for prisoners must include the promotion of health, the prevention of disease and disability, the cure or mitigation of disease, and the rehabilitation of the patient." The sheer numbers of incarcerated inmates who suffer from various diseases and diagnoses exemplifies the need for an effective functional healthcare system within the Department of Corrections. According to the U.S. Bureau of Justice Statistics, as of December 31, 2013, the United States had an estimated 1,574,700 people in state and federal prisons. This does not include those in jail or those on parole. The health of the incarcerated population is a serious issue that must be continually addressed. In 2011 to 2012, an estimated 44% of state and federal prisoners reported ever having a chronic medical condition, compared with only 31% of general population. Not only were both prisoners and jail inmates more likely than the general population to report ever having a chronic condition, but they were also more likely for each specific chronic condition and infectious disease than the general population. Given the fact that correction system can be seen as a community on its own, and because most of the inmates will in fact be returning back into society, the various aspects and foundations of public and community nursing all apply to the correction system. When it comes down to it, the incarcerated population is sicker and requires more medical attention than the general population. Unless something drastic changes in regards to incarceration in the United States, the Department of Corrections healthcare system will continue to be a vital source of healthcare to our communities and citizens. Here are some additional resources that may provide useful for anyone looking further into the Department of Corrections. The first four are different organizations that work closely with the DOC trying to improve various aspects of the system, including healthcare. The Bureau of Justice Statistics as well as the Sentencing Project are excellent resources for various statistics and information gathering regarding the Department of Corrections. And here's a list of references I used for this presentation. I hope you enjoyed it and received some useful information regarding the Department of Corrections healthcare system. If you have any questions, feel free to leave them in the discussion board and I'll try to answer them the best that I can. Thank you.